Seattle, Washington, with more than 700,000 residents, became the epicenter of the battle against COVID-19 in the U.S. when the spread of the disease first began. In just 30 days, it went from 0 cases to 5,000 confirmed cases and 300 deaths across the state, and that was just the beginning. An outbreak that all seems to have started here at the Life Care Center of Kirkland, a nursing home north of Seattle.
And we have several questions.
No one here initially aware of how serious an acute respiratory disease spreading among the elderly truly was, until many started dying one after another, 37 of them in a 3-week period. Each victim memorialized with a blue ribbon tied to trees in front of the facility. Around Seattle, there were thousands of people infected, a fatal, seemingly hidden virus spreading everywhere. We spent a week traveling with several first responder teams and law enforcement officers in Seattle at the beginning of the crisis. An up-close glimpse of life on the front lines of COVID-19. First responders, the most at-risk people now. If they get infected, fewer coronavirus patients will make it to hospitals.
Unconscious person, Meridian at Stone Creek, 1111.
Which could potentially spiral this crisis further out of control. South of Seattle in Pierce County, a woman sits behind a darkened window in the back of this police vehicle.
She was laying face down in the dirt, and she was just kind of walking in and out of traffic, and then was sitting in people's vehicles. So then we detained her and decided the hospital was the best route for her.
The woman needs to be removed from the vehicle and transported to a local hospital. These are the people who have that job: EMTs, emergency medical technicians, paramedics from Central Pierce Fire and Rescue, protecting their faces with respirators and wearing gloves, because it's unclear right now whether the woman behind the glass has the coronavirus, COVID-19.
We're not taking any chances.
As an ambulance arrives on scene, it's now time to take the woman out of the vehicle.
I'll get back.
Okay, yeah.
Thank you.
Thank you.
Authorities ask our film crew to remain at least 6 feet away in case she is infected with the virus. And we must blur this image of the woman to protect her identity and privacy, according to the U.S. federal patient privacy law known as HIPAA, the Health Insurance Portability and Accountability Act. While HIPAA will ensure her privacy, it will make it all but impossible to track whether she's carrying the virus, because that information, once she's transported to the hospital, will not be made public. COVID-19 has drastically changed the way first responders are now trained and prepared to interact with the public. Wearing personal protective equipment known as PPE is the new norm for first responders.
You could don your gloves. And next thing we'll do is put on a gown. Gown's going to be kind of your droplet and splash protection from the patient that might be coughing or sneezing or whatever on you. If you had a high index of suspicion, you could put another set of gloves on, an outer glove. Now that you got the gown donned, I think the next thing that would be important is to don your N95 mask. This is going to be your respiratory protection for coronavirus for yourself. Surgical mask, remember, on the patient, but the N95 for you.
The name of the mask, N95, means the mask will filter at least 95% of all particles and germs that are a certain size. N95 masks are very difficult to find these days.
All right, so the last piece would be donning your eye protection, which would be the goggle. It's going to be a tight seal around your eyes to be able to help protect your sight and make sure that you don't have any splash or anything like that of contaminant.
First responders in Pierce County have seen cases of COVID-19 infection doubling by the day.
Engine 61, and medic 116.
40-year veteran paramedic and Assistant Chief Russ McCallion drives home a point that many first responders have already. COVID-19 cases are expected to rise dramatically once desperately needed test kits for the virus begin arriving to test patients in this community.
In Pierce County, which has 800,000 people, the number of cases increased from 7
yesterday to 14 today.
And by the time this airs,
It could be doubled and doubled and doubled and doubled again because you're testing more people. We have over 160 personnel in our department. Every morning at 8 a.m. our crews do shift change. The firefighters and paramedics work 24-hour shifts.
right now, Chief McCallion briefs his personnel on the latest with COVID-19.
There has been one firefighter confirmed COVID-19 positive up north in the Kirkland area because they kept going in and out of that nursing home without PPE on before this became an issue. And for us, the biggest thing to get a mask on the patient, the source patient, ASAP. The best way to reduce our exposure risk is to get a patient, get that surgical mask on the patient, because that reduces the amount of large droplets that are coming out of that potentially infected patient.
East Pierce firefighter and paramedic Ben Piper is particularly focused on the impact of COVID-19, and particularly focused as he's driving out to a rescue scene about wearing his protective gear so not to get himself or his family infected.
My wife's actually pregnant with our first child now, so it's been something that's on my mind constantly, but with this new COVID-19 outbreak, it's something that's even more on my mind, just making sure that I'm taking as many steps as I can to prevent any sort of illness to her and to my family.
Did you ever think that you'd be facing something like this when you got into the...
Oh, absolutely not. Maybe some other things, and I thought maybe terrorist attacks would be our next biggest hurdle, but it sounds like disease between Ebola, swine flu, this now, seems like that's our next big problem.
Across the state of Washington, first responders are now ordered to conduct an essential interview with citizens before they treat them.
They pause at the front door once it's open and they ask, is there anyone inside who has symptoms of a cough, fever, shortness of breath, diarrhea, things that would indicate there's a possibility of COVID-19 or flu. If anyone has those signs and symptoms, they'll pause, put on their personal protective equipment before they go in.
Under HIPAA privacy laws, McCallion says he is unable to speak about specific cases of coronavirus, though some survivors, he says, are now starting to talk. One of them, COVID-19 survivor Elizabeth Schneider of Seattle.
Were you my sick nurse when I had the coronavirus? Yeah, you kept me company.
I have a background in science and biology, so that's why this experience has been very interesting for me. I did a PhD in bioengineering from the University of California, Berkeley. I have a bachelor's degree in chemical engineering. I had been to a house party with a group of friends. It was a typical house party. People brought over dishes to share. We had beer, wine, and cocktails. We were chit-chatting, enjoying each other's company. I woke up in the morning. I was feeling really tired. I was feeling groggy. And then I took my temperature, and it was 103 degrees. And at that point, I started shivering uncontrollably. I got the chills, and my hands started tingling. I was a little worried at that point because I can't remember the last time that I've had 103-degree fever, and the uncontrollable shivering was a little bit alarming. And it turns out that this woman that posted on Facebook was at that party, and she was posting and saying that she was really feeling bad. She felt sick, and she was asking if anyone else out there had fallen sick as well. So I saw in the comments that a lot of people, about 12 people by my count, replied, and they were all at the party, and they all said, oh my gosh, I'm sick too. I got sick on the same day.
Hi, Cleo.
Now what was interesting is several of these friends went to the doctor, and the doctor all believed that they had the flu as well. They were tested for the flu, and the tests came back negative. So they were sent home. They were not tested for the coronavirus.
The shortages of tests and testing for COVID-19 continue to be a major problem in every U.S. state, making it nearly impossible for anybody to have a true picture of how serious the virus is and how quickly it is spreading. So many people in Seattle don't know if they have been infected, especially those having mild symptoms like Elizabeth.
I did not go to the doctor. I was feeling better and recovering on my own, so I didn't think it was really necessary to go to the doctor. And thankfully, because of my background in science, I realized that if I did go to the doctor, they were just probably going to say that I had a virus and that antibiotics don't work for a virus. And so I was probably going to be told to do the exact same thing that I was doing, stay home, drink fluids, rest. So after a few more days of commiserating back and forth about our various symptoms, that's when one of my friends who was at this party brought to our attention the Seattle flu study. And she recommended that we sign up for it. And so that's ultimately how I found out that I tested positive for COVID-19. When I got the positive test call, what they told me is they said that if you have tested positive, you should stay home for 7 days after the onset of your symptoms or 72 hours after your fever subsides, whatever is the longer of the two. And at that time when they called me on that Saturday, I had surpassed both of those deadlines. So I decided that I could go ahead and live my normal life. I was likely not very contagious anymore. My big takeaway from this experience is that I think there are a lot more people out there among us that are getting sick with this, and they either, don't have very serious symptoms and they just think it's a cold, or they think it's a flu, or they don't have those respiratory symptoms, and they are, unbeknownst to them, potentially, transmitting the virus to other people, and they just aren't getting tested. People living on the street are much more at risk. Their immune systems are weaker than ourselves. Like if you're living out of a van, it's cold, you're more susceptible to catching other things. So yeah, they're definitely more vulnerable.
I got a kiss left to give you, 'cause you were good to me.
Two longtime homeless men south of downtown Seattle are Rudy in his 70s, who lives in this van, and his friend Joe Zacher, who some called the Birdman. Joe says he's an out-of-work construction worker who lives in this car. Asked whose car it is, he says he's borrowed it from a girlfriend. Joe mostly keeps to himself and his pigeons, and watches over Rudy like a hawk. For more than a week now, as the coronavirus spreads across Seattle, Joe says Rudy has been feeling ill. But Rudy refuses to go to the hospital, he says. Joe's asked him several times to go. Rudy just says no.
I'm okay. Don't put no camera above my face.
Coronavirus thing I was worried about too. He is kind of sick. He's more susceptible to it. Probably going to get coronavirus worse than anything else.
What about yourself? How do you feel?
I don't know. Not worried about it. I smoke too much. That's about it. See that lady over there?
Yeah.
Okay, now, they live in a house that has no water, hardly any heat. They can't afford anything. Are you dragging that over there? Let me help you, honey bunny.
Oh, it's kind of heavy. I don't think.
No, it's not.
Can you put it by that can? Okay, thank you. Thank you very much.
Where's your mom?
She's waiting over there by the bus stop.
Okay.
You don't mind taking it there?
No.
Oh.
We know everyone that's homeless around here.
Joe says there's not a person on the street who hasn't heard about the coronavirus, especially with Seattle being one of the cities hardest hit by it.
We should have been a little bit more worried about it. Because America, it seems like we're all America-centric. Most countries think about the world, what's going on in the planet. Americans, we're all about ourselves. The government better make sure that first responders are protected properly. Otherwise, you lose your first responders, what do you got left?
The federal government has been slow in helping solve the severe shortages of PPEs and ventilators. And this lack of personal protection equipment poses a risk for first responders and their ability to get their job done.
We have enough to use on a daily basis to get us through probably another 4 weeks of operations. At that point in time, we, like most of our neighboring agencies, will run out of personal protective equipment. If we don't have PPE, our members will be exposed to COVID-19, which will mean that we'll have to place firefighters and paramedics in the quarantine, which means we then won't have enough firefighters and paramedics to respond to other 911 calls.
I do think that it's going to get worse before it gets better in terms of the number of infections, but I think, you know, so far countries are doing the right thing. They're increasing the number of tests. There's a lot more attention on, you know, the symptoms and signs and self-isolation. And that's one of the reasons why I just put up a fundraiser. So I'm actually partnering with the United Way of King County, and I am trying to raise $10,000 to help folks in King County to support them financially, to support them with food, medicine, shelter, because I think there are a lot of people in this time right now who are going to be really impacted by this.
People like Joe and Rudy.
It's cold, it's dark, it's deep and it's wet.
Are you worried about Rudy?
Yeah. Yeah, if he dies, he's gonna suck. He's been here so long, if Rudy was gone, people all around here would care. I'm not worried about the birds having it. Well, they help me relax. The car's good though. That time. Come on, don't be worried about cars. That's why I play the music. They won't hear the cars. Now, don't be afraid. It's kind of funny. You get one that will break away, it'll change the other minds of the others. Anyways, the birds are getting restless. Just like people, yeah. There you go. There you go. It would be a metaphor for it. They're flying off, everyone's scared, but they always come back. You get back to normal, and they figure it out, and things get done, and no matter what the cost, it all works out in the end, right?